Now to the fight against Ebola, there is still no supply of some of the most promising drugs to treat the virus. And the manufacturer of one of those drugs, called ZMapp, tells CCTV a new supply should be available in a matter of weeks. But that supply is expected to be very small, about a dozen doses or less. CCTV's James Chow is at a World Health Organization summit in Geneva, where the focus is on Ebola. He joins us now live. James.
Thanks very much, Elaine. Well, as you said just there, the mission here is to identify the lead candidate therapies that could be used to contain not only this outbreak, but the next outbreak, which WHO officials say will surely come. One of the exciting developments here is not just looking forward to innovative therapies like ZMapp, but looking back to history. Now, we cast our minds back to 2003 when SARS was at its peak. One of the ways was to use convalescent plasma, that is to blood transfuse using blood from recovered Ebola patients, in this case, for example, and to administer that to patients who are currently being treated in field hospitals. Now, in between, of course, that blood sample needs to be checked for high enough levels of antibodies to not only contain but to prevent any spread of the virus. What we know, of course, is that during SARS, selected patients in Shenzhen in southern China were transfused with blood for exactly the same purpose. The challenge, though, is operating effective and clean blood banks, as well as collecting donors from blood samples, and also making sure that this comes to one collection point in a safe way. The WHO predicts that the first batches of blood samples could roll in by the end of this year. Not only the medical, but of course the social barriers, many people in the worst affected areas in West Africa still challenging the existence of Ebola. They say it's witchcraft that's causing the deaths that they're seeing around them, and that's preventing them from seeking help at treatment centers and clinics in their own communities. Earlier, I spoke to Dr. Bruce Aylward. He's the Assistant Director General here at the WHO. He addressed the social barriers, but also the multifold challenges that come on top of that.
And what happens is a disease like Ebola, because of the way it's transmitted, it can be deeply embedded in the culture of a community, in the way it operates, in its customs, in its funeral or burial procedures. And for this reason, there has to be a huge outreach to the communities. There has to be a huge engagement of the communities, education of the communities, so that they understand the disease. And this takes time. It also takes the right channels. It can't be outside experts telling them. They need their local leaders. To be successful in Ebola, the traditional leaders, the traditional healers, the religious leaders, the local political leaders, they have to understand the disease, and they have to be the ones communicating to their communities, engaging their communities, to get past those problems that you just mentioned and to make sure the response moves forward.
And James, this outbreak has really exposed critical issues with the healthcare infrastructure in parts of the world, especially West Africa. How expensive is this outbreak to try to control?
Well, in two words, Elaine, very expensive, especially two countries, Sierra Leone and Liberia, recovering from more than a decade of civil war. For an outbreak where so little is known, what is known is that the WHO has put a figure out there, $490 million US, to say what it calls effectively respond to this outbreak over the next 6, possibly 9 months at best in the year ahead. Now, the $490 million will mainly be used on treatment centers, but also on transportation. Ebola, though, has been around since 1976, when a group of Belgian scientists, including Professor Peter Piot, who's currently now the head of the London School of Hygiene and Tropical Medicine, co-discovered that virus. But the World Health Organization, at the same time as touting $490 million, admits that it only has $4 million in the bank. That's a very, very low comparison. It says, though, it has two new pledges in the form of the African Development Bank for $60 million, and the World Bank in Washington, it says, has put its name to $100 million. But of course, until that money actually rolls through, much needs to be done, because workers out there in field hospitals in West Africa are still waiting to be paid. As we mentioned, the transportation, the logistics, the resources, all that needs to be paid for. Well, that was one of the challenges addressed at the very opening of this emergency Ebola summit here in Geneva by Dr. Amasoa Ba. He's the Deputy Director General of the WHO, and here's exactly what he said in his own words.
Ebola has raised from an exotic disease to a headline disease. It's therefore no longer acceptable to the general public that a disease that has been around for more than 4 decades, there are no medicines, there are no vaccines.
We'll be bringing lots more interviews to you, Elaine, over the next couple of days. But that's it from me, James Chow, in Geneva. Back to you, Elaine Reyes, over in Washington, D.C.
All right, our very own James Chow reporting live from Geneva.